We are back going through the PRPP, Prehospital Pediatric Readiness Project checklist, which is a way for agencies to examine their own practice and resources and ask, are we ready to take care of children? And also, how do we evaluate our opportunities for improve? The second section of this checklist is, I think, something we think about a lot logistically, but definitely worthwhile sitting down and going through. So it is equipment and supplies. So the first item on this checklist is utilize national consensus recommendations to guide availability of equipment and supplies to treat all ages. So my question for you is, where would somebody find these national consensus recommendations? Because it sounds like there's maybe a checklist somewhere of what are the things that you should have available at your agency, so that they can use that to evaluate their own resources.
Yes, Maya, and we'll share this link with everybody. But the EIIC Pediatric Prehospital Readiness Project website has all of the details that you need in the way of national consensus recommendations, including the Pediatric Readiness of EMS Systems policy statement and technical report. And in addition, in the toolkit, it has the joint statement on recommended ground ambulance equipment that is published in the Prehospital Emergency Care Journal, led by the National Association of EMS Physicians. There's a joint statement made that specifically to this point looks at the equipment and supplies needed for all ages and highlights the pediatric specific, both basic life support and advanced life support equipment that all EMS agencies should try to obtain at baseline.
Awesome. So that's like the starting point. So I can find that list and then I can look at what we carry and then say, do we have everything that we need?
That is correct. They have a table that looks at the equipment and supplies, and then there's also an equipment only list for EMS agencies as well, with the NAEMSP joint statement in the Prehospital Emergency Care Journal, and that was published in 2020.
I'd also interject that through your state EMS for children, the accreditation materials for that, they'll give you the lists of what equipment you need to get that accreditation.
Great.
Yes, thank you, Chief Pinchalk. Yeah, so for instance, Pennsylvania, we have our list through the EMSC as well, EMSC office.
So the next item, I think, really ties in with what we were talking about recently on education and competencies, and that's the process for determining competency on the available equipment and supplies. And I really like this one because I think about this in terms of like pediatric transport. Like I can have a pediatric transport device, but if I don't know how to put it together when I need to put it together, it doesn't get used. Can you give an example of how an agency might formalize that as a process for making sure that everybody is trained up on all the pediatric specific equipment?
Yeah, so in Pennsylvania, there's actually a state protocol for safe transport of children, and it lists the best practices for different scenarios. You know, a kid who's not injured, you're just giving a ride to through a kid that needs acute resuscitation. So Pennsylvania, we train around that protocol because it's good and it hits all the best practices and the national standards. And one thing we like to do for kind of high risk things, we like to do yearly core competencies where through the year, we pick out about a dozen things and we hit them as a review every year. That these are like core competencies. So one of the ones we're doing coming up is safe sedation with ketamine. We just completed a PAL cycle where we did a safe restraint, where you went into the medic units, we went over the integrated car seat we have in there and our neomates and pediamates. And we went through how to apply them properly, what's the safe weight ranges for these, what do you do if I got more than one kid and there's no help? So there's we like to review that every year, and I think it's a good way to approach it. Pick out kind of high risk events and make them a core competency.
I think this one's pretty straightforward, which is get the list of the things that you're supposed to have. And if you don't have it from your state EMSC office, there are national resources that give the recommendations of what you should have to take care of pediatric emergencies, and then go through that list. And I think the first place is to start with the folks who are working at your agency and see whether or not they know how to use all that different equipment, so that in the moment of stress of taking care of a sick kid, they are able to use the resources that are there, because it's more than resource availability. It's the knowledge of how to use it. Thanks.